Well, it's at 6:39. Last year, you probably remember, actress Angelina Jolie shocked the world when she revealed that she had undergone a double mastectomy after finding out she had a gene mutation that made her more susceptible to breast cancer.
And Jolie's choice really increased the public's awareness about this BRCA gene.
Well, now according to a recently released study, women who have the BRCA1 gene should consider removing their ovaries by a certain age. Now, here to talk about the options for women with this genetic mutation is Dr. Heather Einstein, an OB/GYN with Hartford Hospital. Good morning. Thanks so much for waking up early with us here.
I'm happy to be here. Thanks for having me.
Now, these guidelines, or this recently released study, it makes the age earlier than it was before. Is that correct?
Well, before we didn't know exactly when to be recommending that people should be having their tubes and ovaries out, but we had some ideas. This study kind of gives us a little bit more information about that and makes us think that it's probably a good idea for women by the age of 35, if they've completed childbearing, if they have a BRCA1 mutation, to have their tubes and ovaries removed.
Is this something, we've set this up talking about Angelina Jolie, is this something that since there was all that news coverage of her decision, you've seen more questions about?
I definitely have seen some more questions, but really there's a pretty large population of people to whom this applies, particularly in some areas of Connecticut, because we know the BRCA1 and 2 genes are more common in Ashkenazi Jewish people. And so we tend to see this a lot at Harvard Hospital already.
Now, how can people go about finding if they have BRCA1 or BRCA2? I mean, I know a lot of people heard about Angelina Jolie. Can any woman find this out?
Well, that's a great question. I think right now there's a lot of testing out there, and people are thinking, well, I should be getting my genes tested for this or that. And what's really important about this is that you would want to be getting tested if there's actual family history, and in the ideal situation to be the person who has the cancer that would be getting tested for the mutation, because that's the way that we find the most information. If a family member has ovarian cancer and breast cancer or other cancers and have been tested and found to have a BRCA1 or 2 mutation, then it would make sense for another person in the family to get tested to see what their risk is.
And Dr. Einstein, then if someone gets tested, so what are their first steps? They find that out, and now what do they have? Obviously a big decision.
It is, and I think one of the things that are difficult about this is that a lot of times it's young women with a lot of other things going on who are otherwise healthy that are finding this out. And so what we have at Hartford Hospital is we have a group of multidisciplinary people that can help with this. So there are medical oncologists, GYN oncologists like myself, and we have genetic counselors that can help people through this process, along with navigators who can just help deal with this. What we do is you would come and speak with one of the specialties I just mentioned, and we would talk about the risks and benefits of having the tubes and ovaries removed and other types of steps that can be taken to prevent cancer. I think what's exciting about this study that recently came out is that it doesn't just show that we can decrease the risk of cancer, we show that we can decrease the risk of dying from cancer and from all things by having the tubes and ovaries out. It's all-cause mortality. That's a pretty big thing that we are happy about, that we want to be able to help people with.
Great information. Thank you so much, Dr. Einstein from Hartford Hospital, for coming in today.
Thanks for having me.